Welcome to Learning Plan 6. This is on confidentiality, ethical, and legal issues. So we're going to talk a little bit about mandatory reporting. If you work in the helping profession, you are going to be considered a mandatory reporter, and which really means that you don't have a choice when it comes to suspected abuse of children, elders, or dependent adults. So this means that if you suspect that a child is currently being abused, an elder is currently being abused, or a dependent adult, someone that has maybe a cognitive or developmental disability where they can't kind of help themselves or they can't tell someone that they're being abused, you are obligated under the law to report that. So when you talk about mandatory reporting, it has to be imminent. It has to be current. It can't be something that happened 6 months ago and things have changed. You have to look at the fact that if you have working with someone with a substance abuse problem and they've been sober for 6 months, and then they confide in you that a year ago, while they were under the influence of a drug, they were physically abusive to their child. That is not a mandatory reporting situation. It is over with. The parent has admitted they're wrong, and they've been sober for 6 months, and so the circumstances have completely changed. What would be concerning in that situation is if that patient then or that client relapses, because you know that they have the history of that happening, and that's where you would really want to work with your clinical supervisor, get some advice from your colleagues, and maybe decide then that that is a mandatory reporting situation because of the history. So it's really coming down to what's currently going on, not what happened before, and now the circumstances are different. We also want to talk about releases of information. Substance abuse or AODA records are the most protected records in the United States. Mental health records are right behind it. So you need releases of information to release any type of information. It's very, very difficult for any information to be released unless there's a subpoena from a court of law. And even then, sometimes things aren't released. It really depends. So those records are extremely protected, and we have to be extremely careful when we are letting any information out, basically. We can't let information out that we don't have a full release information for. So something to keep in mind. In this learning plan, we're going to talk about HIPAA, and we're also going to talk about duty to warn. In 12.5 years in my substance abuse counseling and social work kind of career, I have seen 2 duty to warns. They don't happen very frequently, but they do happen. And a duty to warn is where someone is in your presence who is saying that they are going to seriously harm another person, like homicide, or they're planning to kill someone or beat them up really bad. And that's where you have the ability to stop the situation by warning the person that is the intended target. This gets really complicated, and sometimes we don't know who the person is that they want to harm, so how do we inform someone when we don't know? But typically we do know. Typically we have a very good idea, and at least we have enough information where we can contact law enforcement, and even law enforcement can help us identify who this person might be. But again, that is rare, and this is where, again, you would pull in your colleagues and your clinical supervisor. You wouldn't do these types of things alone.